Hey everybody, and welcome back to the channel. Thank you so much to all of my new subscribers. The channel's been taking off, so I just wanted to give you all a big thank you. But today we're going to go over chronic constipation. We're going to go over the types, the causes, and the solutions. So at the end, I'm going to give you some really simple tricks that you can do at home along with nutrition in order to help resolve this issue, because I see a lot of patients that have gut dysfunction, they suffer from chronic constipation. And the analogy that I give everybody is that if you're not going to the bathroom at least once a day, that's saying that you're not taking out the trash when you're producing a bag of trash every day, and then you're not taking it out, and that causes the house to become toxic, it becomes smelly. And that's just a simple analogy that I can give when people feel like they're toxic, maybe they have brain fog, digestive issues, gut issues. That's the best way to help people understand what's going on in their body. So you gotta poop at least 1 to 2 times a day is what we want. If you're going any less than that, you're probably going to have toxicity issues because the trash is building up. So let's go over the types of constipation. So I want to put a link to the Bristol chart below so that you can see this. But on the Bristol stool chart, a type 1, which is just separate hard lumps. So I'm going to be looking over here at my notes, but that's just like little, think about like little rabbit poops. It's like there are small little chunks of poop that come out, and that can indicate that you're very constipated, okay? You don't have, forgive my language here, but you don't have kind of like the smooth sausage when it comes to your stool. The second one is the lumpy sausage. So this is kind of, if you took those little balls and just kind of stuck them together, that's the second type that can indicate that you're probably constipated. And when those clump together, a lot of the times it means that you don't have an adequate water intake, which I'm going to go over here in just a second. But there are 3 mechanisms when we talk about constipation. And I'm going to go over these very fast. So if you have questions, just comment below. But normal transit constipation is when the bowels are moving normally, but for some reason, whether it's dietary inadequate water intake, maybe you have a stricture in the bowel that causes you to become constipated. So a lot of the times when everything looks normal as far as like a colonoscopy goes and everything looks like it's moving through well, then you really have to look at the metabolics behind this, water intake, other factors that can contribute to it. And then the next one is the slow transit constipation. Magnesium helps with this a lot because it relaxes the bowel and helps it constrict and contract more so that you can move the bowels through normally, but they're just slow to react. It's a very slow transit through the bowel, obviously by the name. And so magnesium is one of the best things that you can do to help get that bowel moving. Along with, I'm going to go over a stomach massage that I recommend if you just feel like your bowel is slow, if you feel bloated, you don't feel like that the stool is moving through very fast. I've got a really good trick for that at the end. And then the third one is the dyssynergenic constipation. This is a pelvic floor dysfunction cause. This is, especially with women, if you've had kids, if you've had any type of back surgery, any damage to the lumbar plexus, this can cause this type of constipation. And it's when those nerves and muscles don't coordinate and fire appropriately, because you need a kind of a rhythmic contraction and relaxation of the pelvic floor muscles in order to push the stool through. And if there's any dysrhythm in that, then it can cause a stricture at one point. So it's the stool can't move through that certain point if that muscle's staying constipated. Magnesium can help with that as well, as magnesium binds to those muscles and helps them relax. So magnesium, if anything else, is something really good to use. I'm also going to link a pelvic floor rehab link in the description, so you can check that out. If you do have any loss of control or bowel or bladder function, you've had some sort of surgery, or that you just can't control that bladder and bowel very well, then this is a really good resource for that. Now let's go into underlying causes. So The first underlying cause is insufficiency. This is usually how we treat this is through water intake. You need to do about half your body weight in ounces of water per day, maybe a little bit more, especially if you're here in Florida where I am, or you're doing a lot of more physical exercise. But salt intake is very key with that too, because you need to replace electrolytes. So be very conscious about that. And then dietary fiber, which I'm going to go in more in depth when we get to that. And then exercise are the ways that we help with the insufficiency. The next one is overgrowth. This looks like leaky gut, SIBO, dysbiosis within the gut lining itself. I help a lot of people with their gut health because we find a lot of people have overgrowth or bacterial overgrowth or parasites in their gut that are causing brain fog, metabolic issues, hormonal issues. So I'll cover that one in depth as well. The next one is structural. So if there's an actual stricture in your intestinal lining that doesn't allow the stool to move through, then you can take a look at that. That's where this abdominal massage that I'm going to go over, that's where that becomes really handy. However, you do need to, work with a practitioner and always consult with them before you try any of these therapies. So just a little disclaimer out there. And then the gut-brain connection. If the brain doesn't tell the gut to function clearly, then what can happen is that you just have a stasis or a stalling of the bowel movements. And I'm going to talk just a few things about that. That is a lot of the times stress mediated, especially if you're in a high stress environment, high cortisol, that can cause a lot of issues. So let's go over the insufficiency, how to treat that. So like I said, water, you want to do half your body weight in ounces. So for me, I'm 200 pounds. I want to get at least 100 ounces of water in per day. I try to probably aim for a little bit more because I am in Florida and it's just very hot here right now. And so I need to increase my water intake, but I also have to be conscious about increasing my salt intake so that I can hold on to that water. A lot of people get the misconception that if you drink more water, you'll stay hydrated, and that's not true. You have to have salt to hold on to the water. People demonize salt all the time, and I don't want to go on that tangent. You can go check out my other videos, but you do need salt. It's very critical. When we talk about fiber, you want to get about 25 to 30 grams per day. There's an app that I use on my phone. I think it's called Chrono Timer, and I can link that below as well. And it's very easy to track your foods. I don't measure everything, but if I want to see where my calories are at, where my fiber intake is at, where my protein is at, it's just very simple. So I don't get particular, I just estimate everything, and I know that I'm off 100 to 300 calories usually. So 25 to 30 grams, you can supplement this as well. There's Metamucil, there's a lot of different fiber supplements out there that you can use, just whichever one you like. I can always send over a recommendation if you want to put, if anybody needs one. And then you want to do about 150 minutes of moderate exercise. All you have to do is walk for 30 minutes, 5 days a week. You got the weekends off, you don't have to do anything. Now, the second thing that we want to go over is bacterial overgrowth. More people have this than what you would expect, especially if you have a white-coated tongue, recurrent UTI infections, you crave sugar all the time, you're bloated, you're gassy. This is something that you need to look into. I can send over people questionnaires if you really want to take the questionnaires that we use in the office to determine whether you potentially have a SIBO, leaky gut, or some other type of gut dysfunction. They're very easy. They're just questionnaires. We do have some at-home testing too as well, just so that you can see, do you have potential candida overgrowth that hasn't been addressed? And we find that all the time, especially with women that just have hormonal issues, they can't lose weight. It's very common actually. So there are tests for SIBO, there are tests for leaky gut. They are costly. And like I said, we just do everything through questionnaires and through some at-home testing, some little at-home guides, and we have really good results. We're able to figure out what's going on pretty easily. With this, you want to do a low FODMAP diet. You can just Google that and see what that looks like. And that's going to be your best bet to make sure that you're killing off all of these potentially pathogenic bacteria and you're allowing the gut to repopulate correctly. Because if you keep feeding them sugar, which is what they thrive off of, you're never going to correct the gut microbiome. Probiotics, you want to be careful about this because with this, let me just look at my notes here. You can do like lacto-bifido blend, 151 to 50 billion CFUs, 2 to 3 months. Saccharomyces, 10 to 15 CFU, or billion, sorry, for 2 to 3 months. And then soil-based probiotics, 2 to 6 billion CFU, 2 to 3 months. Now, I'm very careful about recommending that to people because sometimes we don't want to cause more of an issue. And sometimes when you put those probiotics in with bad bacteria, it can cause like a little war in your stomach, cause more bloating, more digestive issues. And so you don't always want to do that. So be very careful when you're using probiotics. I think they are great, but it is something that you do want to take into consideration. If you do start using them, you don't want to cause more issues to occur. You can always use digestive enzymes that are going to help break down the foods, especially if you feel like you're not digesting well, you have indigestion, heartburn. There are certain herbals that you can use. Berberine is a great one. Oregano oil is one that I use all the time. And I really like garlic to kill off any of the gut bacteria as well that are pathogenic in nature. So you can add garlic to your meals, and it does a really good job. You can also do the active form allicin in order to help with that as well. And then just nutraceuticals. So nutraceuticals like magnesium citrate or oxide, these can help promote the bowel movements. They're natural laxatives, so you don't have to worry about any pharmaceutical interventions. You can just try those. So just so you guys know, that's magnesium citrate or oxide. So if you want to write that down, then that's what I would suggest. And then the elemental diet, you can do that one as well. But usually the low FODMAP diet does a really good job. The next one is structural. This is where more of your MD is going to get, or your gastroenterologist is going to come into play. So blockages in bowel, usually they find that through like an endoscopy. What they'll find is they'll find tortuosity. And it's really interesting with this because this is where people actually have a longer bowel than most people. And what happens is it kind of like curls around itself and causes a stricture. So, if that's something that you try all these things and they're just not working, you don't have SIBO, you're doing plenty of water, you may just ask your primary care or get a consult with a gastro to see if that's what's going on. Abdominal massages and clockwise circles can help. So what you do is you start at the lower part of the abdomen, just like this is showing here, and that's on the right side. So just so you know, this is the right, this is the left, and you do clockwise circles. And what that does is your bowel goes up, over, and then down on the left side. So you just follow that pathway over like that, kind of like an upside down U, and you just do those small clockwise circles. An interesting story or case that I had was a young kid who had cerebral palsy, and I was working with him to get his function better. And I did that because he was just very underweight, wasn't digesting well, and a 6-inch roundworm came out of him the next day. And the parents were amazed, and that was the first time I had it happen. So I do recommend, obviously they went to their primary and they did a round of antibiotics after that just to clear anything out. But you never know what's inside of you, which is scary. So that's always a story that I like to tell when I talk about any type of gut health. And then the last thing is the gut-brain axis. This is a lot of stress mediated because if your cortisol is high, if you're really stressed, then what will happen is that you will actually not go to the bathroom. So what we want to do is we want to spend time in nature. We want to do meditation, cognitive behavioral therapy, and vagus nerve stimulation. Those are all things that you can do. I'll put some more links to these down below. Just so I'm going to put like the things that you can do to activate your vagus nerve down below, just because there's quite a few of them. And so I think it'll just be easier to do that. But vagus nerve stimulation, that goes down and it helps regulate your gut health, especially if you're just very stressed. If you are going to test cortisol, make sure you do a salivary test, because that's really the only way that you're going to see the true rhythm. I see people getting blood tests all the time and they're not accurate. So I know this was a lot of information. I wanted to make it fast and to the point. Hopefully you all got some good information out of this. And if you have any questions, please just comment below. Make sure that you subscribe, share this with your family or friends, anybody that's struggling with constipation, gut health issues, and hopefully this will get them some help. And yeah, thank you all so much. There's going to be free resources below, and I hope you all have a wonderful day. Bye.